Hi, I'm Dr. Suzanne Kotkin-Jaszi. I'm a faculty member in the MPH program at Fresno State, and I'm here with my student and colleague, Jagir Burke, and we're going to be talking today about the COVID-19 pandemic.
It's a great pleasure to have you, Professor KJ. So what is COVID-19?
COVID-19, unfortunately, is a worldwide pandemic where we first saw cases in the United States starting in January 2020. I just checked the numbers this morning to be accurate. And in the US to date, we have 26,976,488 cases and 461,253 deaths. And regrettably, every day that number is going up. It's called coronavirus because of the spike like appearance of the virus. When you look at it, and you've all seen pictures, it looks like a crown. And corona is just another word for crown. It spreads through the air due to close contact in the form of respiratory droplets or through, unfortunately, airborne transmission. It is possible to pick up coronavirus from surfaces, but most epidemiologists agree that it's much more likely to be transmitted through the air rather than through touching surfaces.
Yeah, it's good to know. So my next question is, why are people hesitant to take the vaccine, and is there a valid concern why people are hesitant to take it?
People are hesitant to take the vaccine because there's a lot of fear in the United States in general about vaccines. It was originally because of a study that asserted that vaccines, particularly the mumps and rubella vaccine, was associated with more autism in children. That study since has been discredited. However, there are always side effects with any vaccine, and many people are concerned with the speed with which the vaccine was developed. So, yes, side effects are pretty typical. When you take a vaccine, usually you have soreness in the arm where the shot went in. And with the corona vaccine, oftentimes you get fever, chills, headache, and sometimes even nausea, but that's only for 24 hours. So ultimately, the benefits of taking the vaccine do outweigh the risk.
So people shouldn't be hesitant, right?
People should not be hesitant. They should be much more concerned about actually getting COVID rather than taking the vaccine. In fact, right now there's a demand for vaccine, and unfortunately, there are not enough doses currently available for all the folks who want to take the vaccine.
Yeah, I heard that too. They're actually pretty short on dosage.
They're very short on doses, so
Yeah.
much so that here in Fresno County, they've had to shut down the fairgrounds as well as they had cited another drive-through at Sierra Orthopedics, and so they're very short. And as a Kaiser member, we're getting emails nearly every day apologizing to Kaiser members about the lack of supply.
Okay, that's good to know too. So why would you say the vaccine is important?
Vaccine is important because basically right now you might have heard there are some new variants coming our way.
Yeah,
The UK variant, another one is the South African variant, and there's one other. I'm really sorry, I'm not quite
I think
remembering.
it's from Brazil, I believe.
That's right. It's the Brazilian variant. Thank you. So basically, if we have the vaccine, we can't get affected, and the virus. The only way it mutates is by replicating. If we have the vaccine, we're not going to get sick, and the virus can't replicate in us. It can't reproduce, and therefore it's going to limit the spread. So it's really, really important to take the vaccine. And I hate to say it, but the older you are, the more your risk is of passing away from COVID, as well as folks who are developmentally disabled, who might have autism or, dare I say, have Down syndrome, people who are immunocompromised, people on cancer drugs. So it's very important, though, for all of us to take the vaccine because we're all striving to work toward what we call herd immunity. When enough people have either had the disease or the vaccine, then it can no longer spread through a population.
So it's important to take it for the safety of others, not just yours, right?
Right. No, don't be selfish about this. Take
Yeah.
for your grandmom and for everyone's grandma.
Yes.
Don't just think only of yourself. As a young person, the probability of you getting really sick is low. Although there have been cases where, as you know, I think that even
Yeah.
people in their 20s have passed away from COVID.
I heard about that too. It's pretty sad to be honest. So my next question is, how effective is the vaccine? The two vaccines that are out, Moderna and Pfizer, like how effective are they?
Okay, so we have two vaccines right now with a third one ready to come online. So the
Mhm.
Pfizer vaccine is, I believe they're both around 85% effective after no, wait, sorry. 95% effective after the second dose. But even at the first dose, we have a fairly high level of immunity. So two doses are better than one, and the CDC recommends two doses. For the Pfizer vaccine, it's to be 3 weeks apart, and for the Moderna vaccine, the second dose should be given at 4 weeks. However, even if you can't get in, Anthony Fauci is reassuring us that even at 6 weeks, we still will get immunity.
Okay, and why is there a week longer for the second dose of Moderna and there's 3 weeks for one Pfizer? Why is that?
I think that when they did the clinical trials and
Mhm.
basically did the phase 3 clinical trials, they found that they got the maximum response if they gave one vaccine 3 weeks apart and the second vaccine 4 weeks apart.
Oh, okay. That's good to know too. So after getting vaccinated, do you recommend wearing masks in public places and crowded places? And
Absolutely. Because we're not really sure at this point whether or not, even after we're vaccinated, whether or not we can still harbor the virus in our nasal area and whether or not we can actually transmit the virus to others. Everyone has to model the appropriate behaviors, and wearing mask is really, really critical,
so maintaining
well
six.
as all the other public health hygiene measures. So continue to wash your hands, continue to social distance, continue to avoid poorly ventilated, crowded indoor spaces.
Yeah, it's for the safety of others. Like you said before, don't be selfish. Think about others. You're saving others as well yourself by doing following all these guidelines. So is there a problem if the second dose of vaccine is delayed?
Um, there's Anthony Fauci, and I'm going to go with what Dr. Fauci tells us. He says um, at that 6 weeks is better than not at all. As far as they know, there's not a major problem. However, if possible, they would recommending following the protocols that were set up when they actually did the phase 3 clinical trial. So the answer is you want to try to go with the 3 weeks and 4 weeks for the second dose. But if you can't, doing it within the 6 week window should still be effective and provide immunity.
Okay, so there is no problem at all, right?
There shouldn't be a problem.
There shouldn't be.
And
Okay.
right now, I think you may know, Jagvir, that there has been some problem in terms of some folks here in our valley getting the second dose because of the supply issues.
Supply issues, yeah.
Yeah, and there has been a lot of debate. I want to say one last thing in closing. There's been a lot of debate in terms of the equity issues associated with vaccination. So there have been some efforts to vaccinate, for example, farm workers who are at higher risk due to their living and working conditions. There has been a lot of discussion in the disabled community or the differently abled community about lack of access to vaccine, even though they're not 75 or 65. They are at higher risk. For example, people with MS and other issues are at higher risk. And they're kind of concerned that right now Governor Newsom is just saying we're going to go by age. So right now they're vaccinating frontline healthcare workers and people over 75. The next group they're going to move down to those 65 and older. But a lot of folks in the disabled community and other grocery store workers, frontline workers, are very concerned because they are sort of moving down in the pecking order for vaccination. And yet every day they face risk at their jobs. They're not
Yeah.
lucky, privileged enough to be able to work from home, for example, or they live in multi-generational households.
So would you say they need to be vaccinated with the healthcare workers as well, like right now?
Well, there's a lot of discussion. I mean, people in prisons are at high risk because they're living in very tight, cramped quarters. Supposedly, Fresno County Jail has among the highest COVID rates of any jail in the United States. And yet, when you say let's vaccinate prisoners again before other folks, it's quite controversial. That's where we see the nexus of politics and public health.
Oh,
I think that I'm going to leave that in our county. They've decided to go by basically by age with some effort to address vaccine equity by taking a look at special populations like farm workers and prisoners.
okay, okay. So there is a debate over like really heated debate over who should be vaccinated before, who should be vaccinated after, like you mentioned, grocery workers, farm workers, and prisoners, and they also need the vaccine because they're
Right.
not lucky enough like we are, so we can stay home, but they can't do that though.
They can. And in New Jersey right now, it's very controversial because they included smokers as one of the highest risk groups. And so I have a lot of cousins who live in New Jersey and they're all, dare I say, rather irate because they can't get the vaccine, but yet people who smoke, which they feel is their choice, but really cigarette smokers are addicts. They
Yeah.
don't have in the long run they could quit, but in the short term they can't. And so it's very, very controversial, these kind of like who should go first.
Okay, okay. That's good to know. That's good information. Thank you, Professor KJ. It was
Thank you. It's lovely